Welcome, everybody. I'd like to start off by talking about schools. We've been working with the local school systems for at least the last 2 months on reopening in the fall. And those plans are not only intricate, but they're also very complex in the sense of what is going to be needed. The thing that I like to make sure that we stress is that we are going to have some sort of school in the fall, and that we always deal with this, and that's getting our kids vaccinated before they go back to school. So want to make sure that, again, the word gets out that let's get vaccinated, let's get those kids vaccinated before they go back to school, so we're not in a rush like we always are every year. So again, getting kids vaccinated going back to school is really important, since we are going to have some sort of school starting off in the next month and a half or so. So with that said, let's talk about what's going on locally. We've been talking about an increase in COVID cases, and I will tell you that over the last week, we've had a very large amount of COVID cases coming in through the labs, and so we're seeing a lot of positives. And over the weekend, we actually probably saw a little over 150 cases come in that pertain to later on in the week of testing, but then also some lagging tests. So we know that a lot of people are getting tested because, again, those tests are starting to lag again, like they kind of were at the beginning, but not as bad for the most part. What does this all mean? This means that we are seeing more cases. There's more community spread. The age group that we're looking at is 56 or so percent of the new cases that are coming in are really that 18 to 30 year olds, and that's important. Shannon, do you have a slide that we might be able to pull up on that graphic? So if you take a look, when we're actually looking at our data, you can kind of see that 18 24 to and then 35 32. You look at the red bar, you definitely see that is our major concern right now with age groups. It's actually flipped from what we saw back in March and April. If you take a look at that 55 to 65 plus, so we definitely see now that those younger individuals are presenting with positives. What does that mean? That means, again, as we've talked about, that younger age group is out and about. Again, we can look at going out to restaurants, but they're actually going back to work. That's a prime age group for that, and they're socializing more. So that is a concern that we need to address. Again, this is community spread, and we have to make sure that we understand that we as individuals need to take it upon ourselves to limit the amount of ability for this virus to spread in the community. How do we do that? Again, the things we've talked about, I can't stress it enough. We really shouldn't be going out as much as we would like to. Again, I want us to go out. I want us to go out to the restaurants to if you would enjoy life. But again, if you see the restaurant you're walking into is packed, turn around, go someplace else. Wash your hands. If you're sick, stay at home. Avoid those large crowds as much as possible. And then, of course, wear the mask and the face covering. I know that is still a gutter reaction for a lot of individuals who don't want to wear the mask, but we know that it does cut down on the amount of infection from this disease from person to person. So again, that is important. It's important because we've heard in the state, many of our counties now are red, which means a mandatory mask use. Again, this is one tool that needs to be used to be able to decrease that ability for this virus to jump from person to person, along with the social distancing, along with the washing of hands, along with the staying at home, all the things we talked about. But again, we have to take it upon ourselves to do those things. If we're not going to do those things, you're going to see these cases rise. We've unfortunately have had over the weekend some discussions with individuals who, again, knew they were sick, went out, and now we're looking at those individuals possibly have again got individuals sick that they didn't need to because they knew they were ill and or positive, yet they decided that they wanted to go out and do something Again, that is a concern, and we need to address that in the sense that if you are quarantined, if you're isolated, if you're not feeling good, if you don't think you should go out, please just stay at home. Just make sure that you don't give this virus the ability from spread to person. The uh, the mask ordinance. Let's talk just a little bit about that. As you know, it's scheduled to be on the council's agenda for Tuesday. And again, if you've been able to take a look at the draft ordinance, it does do what it's supposed to do. Again, it gives us the ability to have outs for the mask. If you have the ability to wear one, it's very important. But again, if you can't because you have some sort of condition, again, under 6, if you're working out, if you're at the dentist, I mean, it has some very logical things where you shouldn't be wearing a mask. But if you're out and about and you're going to be near people, again, we really want that mask to be used. And again, the council will take that up, and we'll see how that vote actually goes tomorrow. A little bit about follow-up with cases. We talked a little bit about Put-in-Bay a few weeks ago, and the concerns that we had there, and the number of individuals that were positive residents that had a connection to Put-in-Bay. Well, actually, now that has grown from not only those individuals that we knew were at Put-in-Bay and were positive, but now we can actually link 16 more residents to those cases from Put-in-Bay. So again, I want to make sure that the community understands how this works. Individual gets sick someplace else, they bring it back into the community, into their homes, and next thing you know, other individuals are going to then become sick as well too. Same thing here with Put-in-Bay. I'm not just focusing on Put-in-Bay because again, this happens everywhere now. When you're going out to restaurants and bars and other large events, we're seeing the same thing. So again, it's just an example to use that this does happen in the community, and we really need to take it upon ourselves to make sure we're doing the things as individuals to not spread this. And I can't stress that enough. The other thing that I'd like to talk about is the idea of being in large groups. We've talked about this so much, but I really want to stress this one more time. When you're going into a large group, you need to, or actually anywhere, you need to think about this as the individual next to me has COVID. That's the best way to think about this, because if you think of it that way, you're going to take precautions for yourself, but then also taking precautions for others in that facility as well. We had a funeral here recently where individuals were sick, and we actually had to go back and look at what was going on in there. And that's why contact tracing is so important. What was going on at that funeral, and it was finally decided after contacting the Department of Health and several discussions that really what we needed to do was anybody who was at that funeral for longer than 15 minutes really should need to be quarantined. And again, contact your doctor if there's any issues with symptoms, if you want to get tested. Again, that's important if you feel you need to be tested. But please remember, when you need to get tested, there is some lag time here. So you have to have enough of virus in your body for that test to actually pick that up. So again, just because you were exposed to somebody one day, you're really not going to have any legitimacy of getting it positive or negative if you go out the very next day and test. So I just wanted to kind of bring us all together and have a discussion about what's going on in the community. But the big thing I really do want to discuss is the cases since July 1st. We have had almost 500 cases, positive cases of COVID inside of our community since July 1st. That's a substantial amount. As you understand too, that the governor is looking at a bunch of different criteria, but one is the number of cases per capita. So again, I'm urging everybody, if we want to make sure that we're not mandated to do things such as wearing a mask, and or possibly if we move into a situation where the governor might have to come back and say you need to start curtailing some of the activities, we really need to take it upon ourselves to stem the tide of the disease. I know that I've also, one last point, I know I've also gotten a lot of emails thanking the health department and others for doing the job they do, but we've also gotten some emails, again, bringing up points and would like to start some dialogue is that, the death rate is not that big, the fatality rate is not that big for this disease. So, why are we so concerned? I'll leave you with this. What happens if that was one of your loved ones who passed away from COVID? That would be devastating. So when we make the comment, well, the fatality rate isn't that great. It's great for some families. It's great for individuals who, have somebody who they knew passed away, as I think we've seen in the media over the last couple of days with some younger individuals who passed away and telling of their story and what they wish they would have done differently.